Hello and welcome to today's presentation. I am Kathleen Helen Lisson. I'm a lymphedema therapist, and today we're going to talk about manual lymphatic drainage and the research which shows that it is more than edema reduction. So, as I mentioned, my name is Kathleen Helen Lisson. I'm a lymphedema therapist. I'm board certified in therapeutic massage and bodywork. I'm the author of the book Stress Reduction for Lymphedema and the book Mindful Strategies for Adults with Adverse Childhood Experiences. So, what are we going to look at in class today? Today is going to be research based. So, we're going to look at different research articles which have studied manual lymphatic drainage. And we're going to look at the effects of manual lymphatic drainage on emotional function, on inflammatory markers, on pain, on quality of life, and on stress. But before we start, I'll invite us to just take a mindful moment. So I'll invite you to sit in your seat in a respectful yet relaxed position. And we're just going to take a moment to reflect here. Your eyes can be open or closed, and your breathing can be natural. And I'll invite you to reflect on why you pressed play on this video. What is your passion in regards to manual lymphatic drainage, in regards to helping clients after a cancer history, or maybe with their holistic health? Do you already know manual lymphatic drainage, or is it something you're curious, you're interested in learning more about? And if you have practiced manual lymphatic drainage before, if you've had manual lymphatic drainage, if you have colleagues that do manual lymphatic drainage, what are the results that you've heard from this massage technique? And what are you most excited about learning about today? What questions kind of do you have in your mind when you looked at the topics that we're going to cover today? Do you already know about some of these effects of manual lymphatic drainage? Have you seen them in your studio, in your own body? Are you interested to see what the proof is of some of these positive effects of MLD? And as I do when I do mindful moments in my classes, we close with a minute of breath work. So we're going to do some 5-5 breathing. I'll have you inhale for the count of 5, exhale for the count of 5. We'll be doing it for 1 minute. Your eyes can be open or closed, and I'll keep the time for us. So we'll start with an exhale and then inhale and exhale. Inhale, exhale. Inhale, exhale. Inhale, exhale. Inhale, exhale. And one more inhale. And then exhale. Go ahead and let that breath work go. And we'll start into a little bit of a range of motion exercise. So I'll invite you to look up as you inhale and look down as you exhale. Up as you inhale, down and exhale. Us looking up, and last looking down. Now you can return your head to a neutral position and look left as you inhale, right as you exhale. Left and inhale, right and exhale. Last left and inhale, and last right and exhale. Return your head to a neutral position, and then we'll take the left ear and place it close to the left shoulder and inhale. Right shoulder and exhale. Left shoulder and inhale. Right shoulder and exhale. Last left shoulder inhaling. And last right shoulder and exhaling. I'll have you lift the hands and point them forward and then place them on the shoulders. And let's do some shoulder rolls. Inhaling as you go up and back, exhaling down and forward. Really moving that shoulder girdle around. One more time in this direction, and then at the bottom, come into the opposite direction. Two more here. Really getting those neck and shoulders warmed up after we did our deep breathing. And then you can release the hands to the thighs. All right, now that we're warmed up, calm down and ready to learn, let's dig in and dive into what is manual lymphatic drainage. So I want to share an email that I got from a client. She said, "Hi, I'm feeling pretty good. I took a long nap after I got home and ended up sleeping for about 12 hours." And this was a client that her plastic surgeon had referred her to me. She was getting reconstructive surgery after her breast cancer. So she got liposuction and a fat transfer to the breast, and I was helping her with manual lymphatic drainage on the areas where she had liposuction. And this is not an isolated comment that I get from just this one client. I have seen this comment or similar over and over again over the 8 years that I've been helping clients. And it's that they're sleeping, that this manual lymphatic drainage is doing more than just moving fluid from one area of the body to the other. It's having these system-wide effects, and it's allowing them to get this nourishing sleep that is so important to them after plastic surgery. And that is the toughest nut to crack as far as a symptom of cancer treatment that for so many people is not really helped by other therapies. They just can't get the sleep. So for a simple technique like manual lymphatic drainage to end up giving someone this long bout of nourishing sleep after surgery is so amazing to me. So let's kind of back up and get our arms around what manual lymphatic drainage really is, because especially if you're not formally trained in it, there's a lot of confusion in the general community about what exactly we mean when we say manual lymphatic drainage. Manual lymphatic drainage is often described as a type of massage that supports the body's lymphatic system. And one giant misconception of MLD is that its only purpose is reducing swelling. And I'm here to show you the research that this gentle skin stretching technique can do so much more. So what is MLD? And let's look right at the textbook. So according to Diseases of the Lymphatics, manual lymphatic drainage is a specific form of lymphatic massage performed by trained therapists that is designed to direct lymph away from congested lymphadematous areas through collateral routes on the trunk to normally draining lymphatic basins. So basically, it's getting the lymph where it is congested and moving it into an area of the body where it can enter the lymphatic system and flow normally into those normally draining lymphatic basins. Why is there a certain order of the strokes of MLD? So MLD is more than just you put your hands on someone and do a stationary circle. There's an order to where we massage first and where we massage next on the body according to where the swelling is and where we want it to drain. Manual lymphatic drainage relies on good preparatory work in, quote, clearing the way ahead, end quote, so that lymph is more likely to flow from filled to empty vessels. And it's important to know there's not just one type of manual lymphatic drainage. There are several styles, and we'll see this. You'll see this when you do your further reading and look at, new research, more research on manual lymphatic drainage. You look into the studies and they will be saying different names of different styles of manual lymphatic drainage. So according to Foldy's textbook of lymphology, and this is a great picture that I took of the sign of the entrance to the Foldy Clinic when I visited there to take a class. It's in Germany, in Hintersarten in the Black Forest. So according to Foldy's textbook of lymphology, Vater-style MLD consists of 4 techniques to stretch the skin and affect the epiphyseal lymph vessels. The 4 techniques are stationary circle, rotary, pump, and scoop. So if you took Vater-style MLD, they will teach you these 4 techniques. But there's more than just that. So let's look at an article by Williams titled Manual Lymphatic Drainage, Exploring the History and Evidence-Based. So 3 other popular methods of MLD include the Casely-Smith method, the Foldy method, and the Leduc method. And if I'll talk about later in the presentation that there is an accompanying, there's also a free continuing education unit class that you can take. And in that class, I show the videos. It's like more detailed than just this short presentation. So if you want to see a video of someone performing all these techniques, that is in the CE class. There are also additional methods of manual lymphatic drainage. The Godoy and Godoy method has rollers, hands. They have a device. They have cervical stimulation in that method. And then the Chickley method was developed by osteopath Dr. Bruno Chickley. So let's look at some research on the benefits of manual lymphatic drainage. So let's look at MLD and emotional function, pain, and stress. And this is study in people with a breast cancer diagnosis. So they found 12 participants. They received MLD sessions after their breast cancer surgery. It was 5 times a week for 4 weeks. And the researchers found that the MLD is an effective method in reducing stress and pain in patients with post-operative breast cancer. Let's look at a randomized controlled crossover study examining MLD in 31 women with breast cancer-related lymphedema. The treatment protocol was 45 minutes of MLD, a total of 15 treatments over a 3-week period. And the researchers found that results from the self-reports that they had their patients fill out, questionnaires, showed that MLD improved emotional function in terms of reducing worry, irritability, tension, and feelings of depression. Let's look at MLD and stress in healthy subjects. So research has also found that MLD can reduce stress in healthy subjects, and they measured this through heart rate variability. So they looked at a 40-minute MLD session, and they found that it was highly effective in increasing the heart rate variability, which is what you want, a more variable heart rate. And it increased cardiac parasympathetic activity, so the activation of the parasympathetic system in normal subjects. So why was HRV used as a measurement in this study? HRV and heart rate variability analysis is based on determination of successive heartbeat intervals and their variability, how variable the intervals are in the heartbeat. And that is believed to reflect the balance between our sympathetic fight and flight nervous system and our parasympathetic, like rest and digest nervous system. And that relates to the activation and regulation of stress. So if someone has more heart rate variability, it means that they're healthier. It means that they have parasympathetic nervous system activation, that the parasympathetic nervous system is active. And here's some research that shows MLD may even be more effective at stress reduction than perhaps even other types of massage. So the researchers investigated abdominal MLD on brain activity of people with psychological stress. So they either received an abdominal massage or MLD for 20 minutes, and the MLD group experienced more acute neural effects that increase relaxation than the control group who just received abdominal massage. So specifically, they found that the people who received MLD had a significantly higher average absolute alpha rhythm. So this is brain waves they looked at, significantly higher relative alpha power, and a lower relative gamma power than those receiving abdominal massage. Let's look at MLD and quality of life in people with lymphedema. So this is a recent, it's 2021, a review article on the quality of life of people with cancer-related lymphedema, and they mentioned several studies. So they looked in their review and they found several studies that when MLD is included in lymphedema care, it improves quality of life for patients with lymphedema. And the researchers said MLD in combination with physical exercise versus physical exercise alone has been found to further ameliorate patients' quality of life. So you want that combination. You want not just physical exercise, but definitely adding the MLD into lymphedema care. And another study in 2022 found they looked at phone interviews to assess psychological conditions and quality of life in patients with primary and secondary lymphedema during the pandemic that we were under. And those that reported that they performed regular self-MLD and their lymphedema exercise demonstrated positive effects on the lymphedema quality of life questionnaire, either the arm or the leg. And it's not just lymphedema. They've also looked at manual lymphatic drainage in people with venous disease. So these researchers conducted a randomized controlled trial. They looked at 41 people with chronic venous insufficiency, and their SEEP score was from C3 to C5. And they looked at the effects of either 10 lower extremity MLD sessions over 4 weeks, and then they got the educational session versus the control group that just got that educational session. And the researchers stated that this study reveals that a 4-week period of MLD treatment, which was 10 40 to 45-minute duration sessions, improved the CVI clinical severity, mostly related to their edema symptoms of leg heaviness and fatigue, and their pain, health-related quality of life. So let's look at the role of MLD in complex decongestive therapy. So these researchers, and the research was published in 2022, stated that gene expression of inflammatory markers can be reduced in lymphedema patients that undergo decongestive therapy. And here's the research from 2021. Patients who underwent CDT with MLD versus their CDT without MLD. So if you did have MLD with your CDT, they found an enhancement in emotions of wellness, lymphedema-related pain, in weight and limb size, in skin tension, in sleep disturbances, and in skin infections. So this is powerful evidence that we need to keep manual lymphatic drainage in our CDT treatment. And also, patients in the CDT plus MLD group had a better quality of life, mainly in the physical and mental dimensions, in role functions, and reduction of pain compared to that control group. So let's look at MLD and how it can benefit people after CDT when they're just in their regular ongoing care. So this is a very interesting randomized crossover study for people who have lymphedema after breast cancer. So these are people who are just directed to ongoing care after their diagnosis. So they received one 60-minute MLD session a week for 4 weeks. And the researchers found that the absence of treatment based on MLD and lymphedema after breast cancer, so not getting MLD treatment, worsens the volume measurements as well as the arm heaviness. Therefore, it will be advisable to carry out this type of therapy as part of the maintenance treatment for lymphedema in breast cancer. And they said that despite having no clear effect on the volume of lymphedema, manual lymphatic drainage could make histological changes in the tissue that improve variables such as arm heaviness, pain, or tension. So these are symptoms that the clients are saying, I'm frustrated because my lymphedema symptoms include arm heaviness, pain, or tension. And MLD can help with those symptoms, even if you put a measuring tape on someone before and after they get MLD, and the measuring tape doesn't see a difference, but their symptoms improve. Now, it's very interesting that in this study, none of the participants did exercise. And that's what we see. We're telling so many people, you have to exercise your arm. But we do see that a lot of people are scared or they just don't. They don't actually do the exercises that are recommended. So it's very important if you have this client that they're just not exercising. None of the participants exercise in either arm of this trial. So this trial is a good reference for our lymphedema clients who are not compliant with their exercise recommendations. So let's look at, we've seen all this research that says, oh, MLD does all these things. Why might it work? And this is for us to have the education to be able to talk to our colleagues about why MLD is important. And it's so important for so many of the patients, the clients, the people that are coming to us, if they understand what is happening, because MLD itself is this gentle technique that they may say, I don't know why it has such big benefits. Why am I going here? When they're not like karate chopping me or really doing these deep tissue elbow in massages, how could it possibly have a benefit? So let's look at what the researchers say about why MLD is so effective for our clients. So it's known that inflammatory mediators present in interstitial tissue as a result of lymph stasis will influence smooth muscle and alter lymph pumping mechanisms. So these inflammatory mediators have an effect on the lymphatic system and how it works, how effectively it works. So this is the Williams research study. MLD could have a role in reversing these processes at an early stage in the development of lymphedema, reducing local inflammation and edema, and restoring function of lymphatic vessels even before a clinically obvious or chronic edema has developed. This is a great study to show someone who says, like, I don't think there's a big problem yet. Why should I still get MLD? What should I, tell myself? What should we tell our clients? What should we tell the people who are referring their patients to us? Why might MLD work? This is Kaser and Esmer from 2019. The autonomic nervous system is spread over many areas of the body and can be found in the blood vessels, the lymphatic vessels, and the connective tissue. So our nervous system is everywhere. It's listening to every tissue of the body. The lymphatic system and the hypothalamus work together to influence the responses of the autonomic nervous system. And MLD has an effect in hormones. MLD can produce significant changes in secretion levels of serotonin, histamine, adrenaline, and noradrenaline. A 30-minute simplified lymphatic drainage session was found to decrease cortisol and DHEA in menopausal women. And cortisol is a stress hormone, and DHEA is used by the body to make estrogen. So this is the study from me that started it all. When I found this study, this was my first indication that MLD was more than just I'm moving fluid through a pipe that doesn't work to try to get it to a pipe that does work. Kaser and Esmer measured their participants' pain levels both before and after an MLD session and found that MLD increases pain threshold. So when you start to feel pain, you can go to more pressure before it starts to be pain, and increases the pain tolerance. So you can actually take more pressure, more sensation before tolerate it before it gets intolerable, significantly in healthy subjects. And they explained that the rhythmic stimuli like manual lymphatic drainage has may create inhibitions on the nociceptive receptors of the skin. And I love having a study to point to because it's not just me and what I've seen with my clients in my office. I have a client that I'd like to playfully refer to her as like the tap dancer because that is exactly what she was doing in her first session with me. She came to me after her liposuction, after her plastic surgery, and she was not able to have her mother touch her in the surgical area. She was not able to touch herself. And she had kind of psyched herself out that this was going to be such a painful procedure, such a painful massage, that she was kind of like kicking and moving her feet. So I knew that I had to approach like very slowly and talk to her and kind of get her into the present moment. And as we went along, I kept on saying, I'm seeing that you're very, very scared that this is going to be painful. Let's see what it is now. Tell me how the sensation is now. Tell me how it is now. Tell me how it is now. And then from the first, when we started doing it to the end of her session, the tap dancing with the feet stopped because as we went slowly and kept on doing the MLD, she said, "Oh my gosh, like the sensation is decreasing, these strong sensations. I'm seeing that I can, even though herself couldn't put her hands on to self massage, she's like, your massage feels so comfortable." And she came back to me at the second session and said, like, I'm able to touch myself. My mother's able to touch myself. And seeing how MLD can increase the pain threshold and the pain tolerance and really give people back their ability to live in their bodies is so amazing. It's one of the most wonderful things, benefits, in addition to people's compression garments fitting looser because they have reduced their swelling. So let's talk about MLD and skin receptors. MLD can increase physical immunity. It can accelerate recovery through body fluid control of the dermal layer. It can accelerate recovery through removal of metabolites. That's what the lymphatic system does. It can increase emotional well-being. It can decrease sympathetic, that fight or flight nerve activity. It can stimulate the dermis, the skin, with abundant distribution of sensory receptors. And that sends a message to the rest of the body. And that may be why the body is sending these messages to the rest of the body and saying, like, this is beneficial to us. And it's not just me telling you all these amazing benefits of MLD. It's this research, and you'll be able to see the research articles with the full titles that you can look up all these articles. They're in the resources at the end of this class. And as we begin to come to the end of the presentation, it's also about the power of touch. Um, Williams says in the paper, women who have breast edema after breast cancer treatment will respond readily to MLD with good long-term outcomes. The use of MLD in this group may highlight how bodywork provides a means through which health professionals can enable people to adjust to and accept changes in their body after cancer treatment. That is why I took my first manual lymphatic drainage class so many years ago, because I'd taken my oncology massage class and they said if someone has lymphedema, is, heavy risk for lymphedema, you can't use your regular techniques on that quadrant of the body. And I just couldn't see only giving someone after cancer 3/4 of a massage. So that's why I went to take the MLD class. I went to take my lymphedema therapy class so I could give people that full body massage. And the power of touch can enable people to adjust to and accept changes in their body after cancer treatment. That's why we're here as oncology massage therapists. That's why I love manual lymphatic drainage so much. So I want to leave you with this quote from an article published in the European Journal of Oncology Nursing in 2012. And it is, many patients prioritize reducing the symptom burden, increasing their function, and improving their quality of life over changes in swelling. We have to get away from just one mode of measuring someone's lymphedema, and that is just the measuring tape, because there's so much more that we can do to reduce their symptom burden that maybe it doesn't show up in the measuring tape. Then we have to use more. We have to actually talk to the client. We're treating more than just an arm, more than just a leg. We're treating a whole body, a soul, a spirit, someone who deserves to have quality of life. And like I said on the bottom, we are doing our clients a disservice if we focus exclusively on the measuring tape to decide if a treatment is benefiting our clients, to decide if we're going to encourage patients to get MLD as a part of their ongoing care. So that is the research that I have for you today. The next couple slides are going to be the link to take that online continuing education class and the resources so you can look more at the research that we went through today. But first, I want to give us a chance to have a mindful moment. We went through a lot of research in a short amount of time. So I'll encourage you to, again, take that position that's respectful yet comfortable. Your eyes can be open or closed, and take a few nourishing breaths. And kind of check in with your body now. We've done a lot of looking, we've done a lot of reading, we've done a lot of listening. What is your response to this research that we've learned? And it's okay to feel a little overwhelmed. It's okay to feel really excited. It's okay to want to get into that class and be able to look over this research even more, look more deeply into why MLD might be having these positive effects on the body. And what are some questions that you have because of this research that we've seen? What do you still want to learn? What are you excited to look on PubMed or Google Scholar about? And what questions do you have? how are you going to take this information that you learned forward into your practice? What are you excited to share with patients, with clients? What studies are you excited to print out and share with colleagues? And as we opened, we can close. We'll again do a minute or so of deeper breathing, slower breathing. So we'll do a 5-count inhale, a 5-count exhale, and I'll keep the time for us. We'll start with a nice exhale and inhale, exhale, inhale, exhale, inhale, exhale, inhale, exhale, inhale, exhale, final inhale, and final exhale. Releasing this practice. And here is the link to the free class. It's at the website plasticsurgeryrecoverymassage.teachable.com. So you'll see many of my classes on that website. Many of them have continuing education from NCB TMB, which is the board, massage therapy board, that I'm board certified with. And many of them will be paid, but if you scroll down, there's a free class of the same title, Manual Lymphatic Drainage, More Than Edema Reduction. When you complete the course, take and pass the quiz, you can email me and I will send you the certificate in email so you can get one continuing education from this class. We are going to look at a lot of the research and see the effects of manual lymphatic drainage on emotional function, inflammatory markers, pain, quality of life, and stress. In a variety of populations, you're going to understand the effects of MLD on the body and the possible mechanisms of action behind these effects. And as I said before, we're going to be able to see short video clips of the different types of MLD styles. So when you look more in depth at research articles in the future on manual lymphatic drainage, and they say, oh, this researcher, this physiotherapist used Leduc, this physiotherapist used Casely Smith, this physiotherapist used Botter, used Godoy and Godoy, you'll be able to picture in your mind what the techniques were that they used. So this is not a certification in MLD. If you want to be certified and be able to practice MLD on someone as a massage therapist, there are many in-person classes. I really recommend a 40-hour in-person class where you can practice on someone live and have your teacher see how you're practicing and give you tips on improving your technique. So when you're doing MLD on clients, you can be really confident that you're doing the right technique because you took an in-person class. This class is online. It's focused on research. It's short. It's only an hour. It's free. And it's for both people who are interested in manual lymphatic drainage and people who have already been doing manual lymphatic drainage and want to kind of be able to more confidently talk about research with their clients, with their colleagues, with the people that are referring patients and clients to them. These are my resources. And I would like to thank you so much for joining me in this class. And I encourage you to take the online continuing education class that I offer. And I hope to see some of your comments and questions on this YouTube video and then also in the class. Thank you and have a great day.